What is leprosy? Leprosy is a disease that can cause serious skin sores and nerve damage in the arms, legs, and other parts of the body. It's been around for a long time. But don't worry, it's not very contagious. You'd have to be close to someone with untreated leprosy and come into contact with their nose and mouth droplets many times to catch it. Children are more likely to get leprosy than adults. Is leprosy still around? Leprosy is uncommon, but it still affects people worldwide. According to the World Health Organization, about 208,000 people have leprosy, with most cases found in Africa and Asia. In the United States, approximately 100 people are diagnosed with leprosy each year, primarily in the South California, Hawaii, and some U.S. territories. How leprosy does affect your body. Leprosy, also known as Hansen's disease, primarily affects the skin and nerves, but can also impact other parts of the body. Here's how it affects different systems. Skin leprosy causes skin lesions, which are discolored patches or nodules on the skin. These lesions may be numb or have reduced sensation. As the disease progresses, the skin may become dry and thickened. Nerves. Leprosy targets the peripheral nerves, leading to nerve damage. This can result in loss of sensation, particularly in the hands, feet, and face. Nerve damage can also cause muscle weakness and paralysis, leading to deformities and disability if left untreated. Eyes. Leprosy can affect the eyes, causing blindness if left untreated. It may lead to inflammation of the eye tissues, corneal ulcers, and damage to the optic nerve. Nasal passages. Leprosy can affect the nasal passages, leading to congestion, nosebleeds, and, in severe cases, collapse of the nasal septum. Bones and joints. Leprosy can cause inflammation of the bones and joints, leading to pain, swelling, and loss of mobility. Internal organs. In advanced cases, leprosy can affect internal organs such as the liver, kidneys, and testes. However, such involvement is rare. Overall, the effects of leprosy on the body can vary depending on the individual and the stage of the disease. Early detection and treatment with multi-drug therapy (MDT) can prevent or minimize these complications and help control the progression of the disease. How is leprosy treated? Treatment depends on the type of leprosy you have. Antibiotics are used to treat the infection, usually for 6 months to a year. If it's serious, you might need antibiotics for longer. But antibiotics can't fix nerve damage. Most people with leprosy get multi-drug therapy (MDT). This means taking 2 or more antibiotics. For paucibacillary leprosy, you take 2 antibiotics daily. For multibacillary leprosy, you take 3 antibiotics daily for 1 to 2 years. You might also take anti-inflammatory drugs like prednisone to help with nerve pain. Sometimes doctors use thalidomide to treat skin nodules, but it can cause serious birth defects. Don't take it if you're pregnant or plan to be. Symptoms of leprosy. Leprosy mainly affects your skin and the nerves outside your brain and spine. It can also harm your eyes and the tissue inside your nose. The main sign is skin sores or bumps that don't go away for a long time. These sores are flat and lighter than your skin. Other signs may include stiff, thick, or dry skin, growths on the skin, swelling on your face or ears. Nerve damage can cause no feeling in certain areas, so you might not feel pain and could get hurt, weak muscles, eye problems, stuffy nose or nosebleeds. As leprosy gets worse, you might see loss of eyebrows and eyelashes, sores on your feet that won't heal, pain, redness, and burning, changes in your nose, hands or feet, blindness, shorter fingers and toes, paralysis in your feet and hands. It usually takes 3 to 5 years for symptoms to show after you catch the bacteria that cause leprosy. Some people don't show symptoms until 20 years later. This time is called the incubation period. It's hard for doctors to know when and where someone got infected because leprosy takes so long to show up. Leprosy prevention. Finding and treating leprosy early is important to stop it from spreading. Even though it's not very contagious, you can lower your chances of getting it by staying away from close contact with people who have it, especially their skin or fluids. If someone in your home has been near a person with leprosy, see a doctor right away. You'll need to have checkups for at least 5 years to make sure you stay healthy. Leprosy diagnosis. If you might have leprosy, the doctor will take a small piece of the skin sore and send it to a lab for testing. This is called a skin biopsy. They might also do a skin smear test. If you have a few bacteria, it's paucibacillary leprosy, but if you have more, it's multibacillary leprosy. To know which type you have, you might need a leporine skin test. The doctor will inject little inactive leprosy causing bacteria under your skin and check for a reaction after 3 days and again after 28 days. If you react, you might have a certain type of leprosy. If you don't react, you might not have leprosy or have a different type.